There is a common myth. It says people with mental health diagnoses cannot hold jobs. It suggests they cannot learn new skills. This myth creates barriers, it limits opportunities, it fosters a sense of hopelessness. It is a belief that occupational therapists challenge every single day. The truth is that action changes everything. Engagement in meaningful activity is fundamental to health. With the right support, people can learn, grow, participate fully in their communities. This guide provides clear ideas for your practice. It focuses on 4 common diagnoses. Schizophrenia is a serious and long-term brain condition. It fundamentally changes how a person thinks, feels, perceives the world around them. It is not a split personality. Instead, it can cause a person to lose touch with reality. A person might experience hallucinations. This means they see, hear, taste, feel things that are not actually there. Auditory hallucinations, like hearing voices, are particularly common. They may also have delusions, strong, fixed beliefs not based in reality. Speech may become disorganized and hard to follow. Negative symptoms include flat affect and lack of motivation. Executive functions like planning, organizing, problem-solving are often impaired. Symptoms profoundly impact daily life and make modern living very challenging. One of the most effective OT strategies for schizophrenia is to establish simple, predictable routines. We can help by breaking down essential activities into very small, manageable steps with visual cue cards. Practice at the same time every day to help it become automatic. Another crucial strategy is to build reality testing skills, gently and supportively. Use collaborative questions. Let's check the facts. Is this thought a fact or a feeling? Introduce grounding techniques. Name 5 objects. Describe their colors and shapes. Practice in the actual places where the skills are needed. Start with 1 or 2 items. Role play beforehand and praise small successes. Always screen for command hallucinations. Support medication adherence with organizers and discuss side effects like grogginess or tremors. Create a low-stress environment by reducing noise and clutter and lowering social demands when possible. Depression is much more than just feeling sad for a little while. It is a persistent and pervasive mood disorder. A core feature is anhedonia, with overwhelming fatigue that makes small tasks feel monumental. Thinking may become slow and foggy. Physical symptoms ripple through the body. Sleep patterns are often severely disrupted, insomnia or hypersomnia. Appetite may decrease or increase. Work and study performance often declines with missed days, poor concentration, and missed deadlines. Social life shrinks, isolation fuels depression. Self-care, home care, and meal preparation suffer, reinforcing negative self-image. It's really tough. A cornerstone of OT intervention for depression is activity scheduling, also known as behavioral activation. Start with a single task lasting 10 to 20 minutes. Necessary tasks: brushing teeth, enjoyable tasks, listening to 1 song. Social tasks: sending 1 text message. Completing a planned activity begins to challenge helplessness. Break larger tasks into tiny steps and acknowledge each one to rebuild self-efficacy. Help clients identify small activities that lift mood. A short walk, music, a simple craft, or a call to a supportive friend. Track mood before and after to see impacts. Always ask directly about suicidal thoughts. Are you having thoughts of ending your life? Follow crisis protocols when risk is present and help build a safety plan with hotlines, safe people, and coping strategies. Anxiety is more than just normal worry. It's a state of intense fear and apprehension. It manifests in the body. Heart racing, quick shallow breathing, muscle tension, stomach pain, nausea. Panic attacks are sudden, overwhelming surges of fear. Avoidance becomes primary, skipping gatherings, avoiding calls, even staying home. It can jeopardize employment and education. Concentration suffers. Sleep and appetite are disrupted, worsening anxiety. Avoidance brings short-term relief that reinforces fear, shrinking independence over time. Life becomes organized around avoiding anxiety, and the world looks like threats instead of opportunities. A foundational OT strategy is teaching simple breathing and grounding techniques. Teach box breathing. Inhale 4, hold 4, exhale 4, hold 4. Also teach slow belly breathing. Use the 5-4-3-2-1 technique to pull attention outward. Use collaborative graded exposure with small steps at an agreed pace. Start with role play, then say hello to a cashier, then a short coffee visit. Make tasks predictable with clear plans, visual schedules, time cues, and gentle rehearsal. Be vigilant for severe panic or agoraphobia. Work in a team and advocate for psychotherapy and psychiatry. Avoid forcing exposure. Move at a safe pace and rule out medical causes for symptoms like chest pain or dizziness. Bipolar disorder is a condition defined by extreme shifts in mood, energy, activity levels. People cycle between depression and mania or hypomania. Manic episodes bring extremely high energy, decreased need for sleep, and racing thoughts. Judgment may be impaired, leading to risky behaviors and impulsive decisions. Establish consistent sleep, wake, and structured daily routines as an anchor. Use mood and activity charting to identify patterns and early warning signs. Create a clear action plan for early signs. Limit harm during mania, support medication adherence, and strengthen the support network. While each diagnosis has unique features, several OT tools apply across the board. Activity analysis, task breakdown, and environment modification make a huge difference. Link to values, build meaningful activities, and train core skills. Effective practice is teamwork. Share plans, join meetings, and coordinate a seamless web of support. The myth says diagnosis equals limitation. Our action as OTs proves otherwise. Small steps, real-world practice, routines, simple tools, safety plans. We start where the person is and move toward what matters. This is the heart of occupational therapy. We are partners in hope, and our medium is the healing power of occupation.